Thanks for watching Hit Exchange Media's Peer Exchange, a three-part installation exploring the maturation of mobile devices used in healthcare and sponsored by Good Technology. In this segment, taped at a recent Health Information Technology conference, the panelists discuss mobile device security strategies. Our panelists are Humberto Quintanar, Chief Information Officer of Antelope Valley Hospital in Lancaster, California, David Kimson, CIO at Maricopa Integrated Health System in Phoenix, Arizona, and Dimitri Volkman, Good Technology's Vice President of Enterprise Product Strategy and Planning. Now to kick off the discussion, let's join our moderator, Hit Exchange Executive Editor, Eric Hibbs.
Looking back at our first experiences with smartphones, email was the first killer app. And thankfully, the platforms have matured quite a bit, as has our ability to secure them. Please share with us some of your insights in terms of what is your mobile device security strategy, and what tips do you have for other colleagues of yours that may be formulating theirs?
We have a strategy for the physicians to use their iPhones. We're working on trying to get it secure. It's the ability to carry that EPHI that we have to be very careful with. If they grab information and they carry it with them and that phone gets lost and it has patient information in it, then we're in trouble. And the physicians don't seem to quite understand that. They want to do it because they want to do it. It's easy for them, but they don't think about losing that and the hospital being responsible for all that information. So until we have it very secure, it's going to be really difficult. The other piece of it is trying to provide them with images, radiology images on the phones. There are a lot of physicians that are asking, why can I not see my pictures on here? And they can. We can provide it to them today. But the usability of that little tiny screen to see makes it very difficult. So it's more of it's a cool thing to have, but I don't think they can use it very well to do what they need to do with the picture. But we can provide it. Can we secure it? Maybe, maybe not. And the idea is that until it is secure, at least from my perspective, I can't allow it to go out there and be on those phones.
Dave, how about your mobile device strategy?
Our email strategy on mobile devices has evolved over the time that I've been there. First and foremost, I think only corporate email can be used for business, both for our physicians and for our internal staff. So personal email, while can be accessed at work, by policy is prohibited for conducting official business. Additionally, sending PHI through email unsecured within the network between provider and employee, etc., is allowed. We don't require an internal encryption for a message that's trafficking within our firewall. However, whenever a message is being sent outside of our domain to an email address outside of our domain, we do require encryption. We have a separate appliance and security infrastructure that allows them to do that. And I should say, whenever an email that has PHI in it, or not every email. As we look at extending that generic framework or policy to the mobile device, when I first got there, the only way we were doing that was through BlackBerry. And for a number of reasons, we decided, largely due to the consumer demand for these other types of smartphones, we decided to leave BlackBerry in place, but to move towards Good as an alternative platform. Shortly after we did that, we moved away from a corporate-provided phone, which we were only providing BlackBerries, to the stipend approach. And it was very interesting because we offered people their BlackBerry. They could keep it at no cost and remain connected and simply start getting the stipend to offset their monthly plan. And in most cases, in fact, in only a very few cases did they keep that BlackBerry. In most cases, they said, thank you very much, they handed it back, and they went out and spent their own money and bought a device that they then connected through Good. Our policy now really is to let the consumer choice drive that, but limit them in that the only way they're going to connect that device that they've purchased to our network is through the Good platform, so that we can control it and that we can wipe it when the employee leaves or if the device is stolen.
Has achieving a level of comfort with email security caused you to explore possibly mobile enabling other services that you offer?
Yes and no. It depends on the app. We're trying to give them more apps today, but for the most part, they're coming into the hospital using Citrix, for example, to get to our systems. There are very few apps that we can put on those phones right now. Like the RSA token is one of the apps that we put on the phone. It's very, very difficult because we don't have any control over it, and we need to be able to control the app and make sure that they know how to use it the right way. And today, we don't have that many in any of the phones. Very, very little.
You know, from my perspective, it's not so much that we delivered email that's causing that, but more as consumers, physicians, consumers, employee consumers are able to do things like interact with their bank through their telephone. They're asking the question and they're creating the demand, why can't we do more of our business at MIHS through that device? You know, from my perspective, probably the biggest demand there is that file synchronization, that document management piece. That's the one I hear most often. As we're moving and rolling out EHR in the hospital world, I think we're going to see a corresponding demand for mobility on the EHR platform, specifically around workflows that a physician might be asked to do while on call, or use cases that they might be asked to do on call. As we're live in the ambulatory environment, for the most part, those physicians are working normal office hours. They're coming into work. They're doing it. At the end of the day, they close up shop, and they're generally not being called. Different in an acute environment, where that physician is doing a call rotation. And if we can give them the ability to answer a workflow by scanning a patient record or authorizing an order through their mobile platform, we might be able to save them a trip to the office or save them getting out of bed even. And that would be a huge satisfier. So I think that's really what's driving us looking at that functionality.
They're asking us to do more on their iPhones, for example, to do research while they're taking care of their patients, to do calculations, to access evidence-based information so that they can do the right things. So we're slowly giving access to certain websites so that the nurses and the physicians can do that through their iPhones. We also have, we created our own OR board, and it was such a success that now the physicians want to have that board on their phone so they don't have to come to the floor and take a look at what's going on in the OR room. They can look at it on the phone. And that's something that just happened in the last 2-3 weeks. And little by little, we're creating more applications internally for them to use.
Yeah, this is very actually consistent with what we see from our customers. So the obvious number one use case was the email. The second one is actually around documents, as we discussed. Then a lot of things around business intelligence. How do I get synthetic data? And then the last one you mentioned is about workflow. How do I do business process automation and workflows for my devices? So, and to your concern of security, this is why we've actually created that platform where you can actually create the same concept of separation of personal and enterprise at the level of the application. So those applications that you would build or mobilize, you will be able to control tightly and leave the rest of the device intact.
From an innovator's perspective, do you see the industry stepping up and providing the types of solutions that there's an obvious need for?
Well, we fundamentally believe, as I touched on earlier, on the separation of the personal and enterprise on those devices, because we fundamentally believe that this point of control, the device, this endpoint, is actually not over time going to be managed by the enterprise. So the enterprise will manage the application and the data inside the application. So that's what we see happening, and there's a lot of demand around that. So we've created that platform so a whole ecosystem of partners and customers can come here, look at what data they need to protect, bundle that or containerize that in their application, deploy that application with the confidence that they can manage this application, remove the access, remove the content without touching the rest of the device. So So that's really what we see happening in the coming 18 months.
That becomes a minimum standard of doing business in the, the entry point there. I mean, we in healthcare, we can't afford the risk if a device gets stolen or if a communication gets intercepted that there's a breach. So regardless of the benefit that we might gain from mobilizing a workflow, if we can't do it in a secure way that we can guarantee that there won't be a HIPAA breach because of unsecure software or a stolen device, we're just not going to go there.
So I'd like to thank each of you for your participation in this panel discussion, and I believe our audience has gotten some great information from it, so thanks to each of you.
Thank you.
Thank you.
Thanks for watching the third segment of this three-part series sponsored by Good Technology. Be sure to catch the additional segments in which our panelists discuss mobile operating system and device trends and answer the question, will tablets replace laptops?